I'm honored to present today's Zoominar with our distinguished panelists. The day we all have been waiting for has finally arrived. There are two safe, effective vaccines that have become available. Soon we'll probably have the Johnson & Johnson vaccine. Today you will hear from experts on the safety and efficacy of the vaccine and get the latest updates regarding vaccine distribution. The Alameda County Public Health Department, Alameda County Healthcare Services Agency, and other healthcare providers have been working tirelessly to make sure vaccines are getting distributed quickly and equitably. It's been great to see the enthusiasm from the community to get the vaccine. The governor's been working with the Biden administration to obtain more vaccines and ramp up our vaccine effort. It's important to continue to check with your doctor, as they will be familiar with your medical provider's system of vaccine distribution. You can also sign up to be notified when a vaccine may be available to you through the county website or myturn.com. Anika will speak more on this. Just last week, I was happy to join Governor Newsom at the Alameda County Office of Education for the launch of our first in the nation FEMA mobile vaccination clinic. That was for teachers. This effort will be to get our education workforce vaccinated. The first speaker today is Miss Anika Chaudhry, the Assistant Agency Director at the Alameda County Healthcare Services Agency. She oversees policies and communication strategy for the agency and facilitates cross-departmental initiatives, collaborations, and external partnerships. Prior to joining Alameda County in 2018, Anika served in the San Francisco Mayor's Office and spent several years in the San Francisco Department of Public Health. Anika?
Thank you, Dr. Quirk. Thanks so very much for having us here. And I'll just start a little bit. The Alameda County Healthcare Services Agency comprises our public health department, which is the lead on our COVID efforts. We also have a behavioral health and environmental health, and then a whole host of programs that serve people who are uninsured or are experiencing homelessness. So again, thank you all for having us here. So for our vaccination update, we began vaccinating in Alameda County for COVID-19 in mid-December. And our strategy is generally to have vaccine available in as many places as possible. So that includes large points of distribution known as pods, which is such as the one that we launched earlier last week at the Alameda County Fairgrounds. It also includes community pods like the ones we have in the Fruitvale, and which is a smaller pod that does about 600 doses per day, is open 4 days a week, whereas the Fairgrounds is open also 4 days a week, but has the capacity to do thousands of doses per day and is a drive-through site. Then we've recently also been gifted a pod by the state and federal government at the Alameda County and Oakland Coliseum. And this is a FEMA and state partnership where they can do upwards of 6,000 doses a day, which is a really, really big boost. And then we're also deploying mobile strategies. So we've got partnerships with various pharmacies that have helped us get to long-term care facilities and senior facilities, senior living, assisted living facilities, et cetera, which are places that the federal partnership may have missed. And then lastly, we also provide vaccine to all of our community clinics. So that would include, we have 8 or 9 federally qualified health centers throughout the county. There's one in at least all of the geographies. So they're able to offer vaccine to their clients. And we're also partnering with them to send them other people who can be vaccinated there. So, currently we're vaccinating healthcare workers, people who are over the age of 65, and essential workers in food and agriculture, education and childcare, and emergency services. So for all of these categories, we're using definitions set by the state and doing our best within those categories to prioritize people who otherwise wouldn't have access. So, you know, if you're on Medi-Cal or you're uninsured, we want to prioritize you for a county pod. If you have the option to work from home, we're asking that you please wait because people who are older, so the people who are over 65, are at higher risk of death or severe illness from COVID-19. And then people who are frontline workers and don't have the option to work from home are at higher risk of exposure and spreading the disease to others. And so, you know, we're trying to prioritize them. We receive about 15 to 17,000 doses of vaccine per week from the state. And that's clearly not enough to meet all of the demand that we've got out there. But as Dr. Quirk said, you know, we are hearing from the federal government that vaccine supply is expected to increase. And we do have a commitment from the state for that, for our supply to remain consistent, at least for the next few weeks. So you can go to our website to track how we're doing. We have a data dashboard that includes a lot of COVID-19 data, including trends on case rates and testing. And recently we've added vaccination to that. And that data is broken down by age, gender, race, ethnicity, and place of residence. So to date, we've had more than 268,000 Alameda County residents have received at least one dose of the vaccination, and more than 95,000 have received their second dose. So that's putting us upwards of 7 to 8% of our population that's over the age of 16 has gotten fully vaccinated. So we're excited about that, but obviously a lot more progress to make to get enough people vaccinated. I'll also note that those data are skewed toward healthcare workers because they've been a really large proportion. Alameda County had more than 145,000 healthcare workers. And then for phase 1B, which includes people over 65 and some of those essential workers, that's another 325,000 people that we estimate. So it's going to take us a little while to get through them, but we're making progress little by little. And we're really, really thankful to have the Coliseum resource there for a while because it, again, can do 42,000 doses per week compared to our 15 to 17,000. And it's an additional infusion of vaccine. And so it's really enabling us to increase our efforts for our smaller community-based pods and for us to do outreach to people to make sure that we can get them access. So I know there will probably be a lot of questions, but I'll stop there and turn it back to Dr. Quirk.
Thank you, Anika. So next up is Scott Bierin. He's a postdoc at the UC Berkeley School of Public Health. Please go ahead.
Thank you, Dr. Quirk, for that introduction. So yeah, as Dr. Quirk mentioned, I'm a postdoctoral scholar at UC Berkeley, and my training is in molecular virology. I study more or less how viruses cause disease, how they cause pathogenesis. So at the beginning of the COVID-19 shelter-in-place pandemic, a lot of the virologists and microbiologists really across the country shifted their focus to study the virus and to understand essentially how we can figure out new therapeutics against this virus and figure out how it causes disease and what's unique about it. But kind of on that topic, since we're here today specifically talking about vaccines, many of our efforts have been focused on therapeutics. But as the vaccines have become available, we've all become very excited about the potential for these vaccines to really improve the conditions of the COVID-19 pandemic. So a little bit of background, just to kind of break it down from the molecular basis. COVID-19 is caused by a virus called SARS coronavirus 2. SARS coronavirus 2 is a microbe. There are many different types of microbes like bacteria and viruses. Viruses are unique because they actually invade our cells and make our cells components produce more of itself. It essentially completely uses our own cells. And it copies its genome. It makes more viruses over and over until our body produces essentially a harmful immune response. And what we can do against pathogens like SARS coronavirus 2 is either have therapeutics or make vaccines. And essentially what a vaccine is training your immune response to respond to this virus before you get infected. And for SARS coronavirus 2, one of the essential proteins that it needs to invade your cell is a glycoprotein on the surface of the virus known as spike. They call it spike because it kind of looks like a spike of crowns on the surface of the virion. So both primary vaccines, the Moderna and the Pfizer vaccine, are subunit vaccines, which means that they are composed of essentially one component of the virus. There's a couple of different types of vaccines. There's live attenuated, where you kill the virus or you weaken the virus so it can essentially mount an immune response without causing disease. There's subunit, which is a part of the vaccine, and there's a killed vaccine. So the subunit vaccines are very effective because they elicit the right type of immune response that is protective, but not necessarily harmful. And specifically today, we'll focus on the B cell response. So both the Moderna and the Pfizer vaccine produce a very, very effective response against the spike protein. They produce a lot of antibodies against this protein, which are protective. And these vaccines so far have, considering the speed at which they were produced, have far exceeded our expectations. They are very safe and very effective. And yeah, essentially, that's where we stand. I think there are some further questions on that topic later, but I guess I'll stop there.
Very good, Scott. Thank you. Finally, we have Dr. Timothy Brewer, a professor of epidemiology at UCL Fielding School of Public Health and Medicine. He served on advisory boards and review panels for the World Health Organization and the National Institutes of Health, the Canadian Institute of Health Research, and the U.S. Centers for Disease Control and Prevention, among others.
Thank you. Go ahead. Thank you very much, Dr. Quirk. What I'd like to do is just build a little bit off of what Scott said. So I'm a doctor, I'm a physician, I take care of patients, I also do research on infectious diseases. So we now have 2 vaccines available in the United States, the Pfizer and the Moderna. We have a third one, Johnson & Johnson, that's under consideration. All of these vaccines have one thing in common, and that is they can't cause disease. So these vaccines take a piece of the virus, they introduce it into the body, and they allow our own bodies to then make the protein that the immune system recognizes to fight the virus off should you become infected. The second thing to remember is, as Scott mentioned, these vaccines are very good. So the Pfizer and Moderna vaccines are about 94, 95% effective in preventing symptomatic COVID-19 disease. So that's disease caused by the virus Scott mentioned, SARS-CoV-2. And the Johnson & Johnson vaccine is about 66% effective. But the good news on the Johnson & Johnson vaccine is that it's 100% effective against preventing hospitalizations and deaths. So those really serious diseases that we worry about, Johnson & Johnson vaccine just as good as the Pfizer and the Moderna vaccines. And so far, not a whole lot of side effects that we worry about, sore arms, a little bit of fever. Rarely you can get bad allergic reaction, but fortunately, so far, those are uncommon. Dr. Quirk also just asked me to briefly talk about variants. So as Scott mentioned, SARS-CoV-2 is an RNA virus. The reason that's important is that these viruses can make mistakes as they replicate, and they can change as they replicate and spread. We call those mutations. And so it's natural for an RNA virus like a SARS-CoV-2 to do that. And when that happens, you can get new variants or strains formed. So this is a natural process of the virus. The vast majority of these changes have no impact on the virus at all. They don't make it more deadly. They don't make it easier to spread. But sometimes a change can happen where in fact the virus does become easier to spread, for example. So there are now 4 variants that we're kind of keeping our eyes on, though there are actually many more out there in the world today that may have some impact on how the COVID-19 pandemic will play out. And I'm going to actually refer to them by their locations, not their numbers. So one is from United Kingdom, or the UK variant. Second is South Africa. Third is Brazil. And the fourth is California. And then there's a new one in New York as well that we could touch on if there's time at the end. And the important thing to know is that the UK variant does spread more easily. So there is a change in that spike protein that Scott was telling you about, that because of the UK variant code has shifted, it has allowed this spike protein to bind better to human cells, easier to transmit from person to person. I think those data are very good right now. Some people believe that it may be more serious, cause more serious infection. I don't think that's as clear. The good news is the vaccines work just as well against this variant as the traditional regular virus. So no change really in vaccine efficacy at all. The South Africa and the Brazil variants have a slightly different change to them, which has also may make it easier to spread, but unfortunately also means that our immune response is quite not as vigorous against these viruses as against the original wild type virus. And so when we look in the laboratory and we take serum from patients who've been vaccinated, take out those antibodies that Scott was mentioning and say, do they block the virus? They do not block the South Africa and Brazil virus quite as well as they do the UK virus or the wild type virus. The good news, however, is the level of protection that you still get from that sera is above what we think we need to keep people from getting serious disease. And in fact, so far, there has not been any hospitalizations or deaths associated with some of the vaccine trials. And 2 vaccines were actually tested in South Africa and Brazil, the Johnson & Johnson and the AstraZeneca. The AstraZeneca is not available in the United States. And while those vaccines did not work as well against that virus as they did the virus that's in the US, there was no serious disease or death associated with them. So while this virus is changing a little bit, so far the vaccines still seem to be providing the important protection we need to prevent hospitalization and death. So I'll stop there. I know that's a lot to cover, and I'll look forward to answering any questions as we go along.
Thank you very much. We'll start on the question period. The first question I have is for Anika, and that is, if you're here in Alameda County, certainly if you're in Kaiser or you're part of the Stanford system or Sutter system, you can find out about appointments with those healthcare providers. The clinic that's best known, I think, in this part of Alameda County where we live is Tiburcio Vasquez. You can get appointments through them. But if you have a doctor who's just in private practice and you don't have access to one of those systems, and how do you go about finding out when you're eligible and then signing up to get a vaccine? And Anika, could you give us an answer to that?
Sure. So in terms of on our website, we have it's covid-19.acgov.com. And so we have a COVID-19 website. There's a whole page that's dedicated to vaccine information. That page is translatable in multiple languages. And then within it, it has a bunch of FAQs as well as information about how to sign up for things. At the top of the page, you'll see a notification form that says, sign up to get notified. And so you can sign up yourself there. And we have that form available in Chinese and in Spanish, as well as English. And so on the back end, we at the county use that form to pull out people who are eligible, and we send them an email to get signed up. We're also working on a hotline or a number for people who don't have easy web access or need help to get through to that. So you're also welcome to call our COVID line, which is, I think it's 510-268-2101. And somebody can help you navigate signing on to that site. You can also call 211. They won't be able to give you appointments, but what they can do is tell you where there might be vaccine available somewhere near you, and how you might be able to sign up. So our notification list is the best bet to go with, or you could also try myturn.ca.gov, which is the state system. But my turn right now is only available for the Coliseum. So if you're able to go to the Coliseum, then it might work for you. If you're not able to get to the Coliseum, then that's not really a good option at the moment.
Yeah, and I was on, by the way, it is myturn.ca.com, as she said, not myturn.com.
Oh, sorry.
And she got it right, and I got it wrong. Myturn.ca.com, I just used it, and it says no appointments available. I don't think it'll be a big help for you today.
Yeah.
But going to the county website, which I've also done, there's quite a bit more information there. And particularly if you're in one of these HMO or other organizations, you'll be able to get something through them. So let me now get to my next questions. If you're a non-English speaker, and there may be some online today, what's the best way to find out about vaccine availability? How are you making that information available?
Yeah, so again, in this space, we work a lot with our partners. So many of the clinics that you've mentioned, so Tiburcio Vasquez, Asian Health Services, Bay Area Community Health, as well as La Familia is another partner organization that we work a lot with. So our website, if you go, each of the pages on our website, if you go to the top right, there's a Google Translate button, and so it can translate all of the materials into multiple languages. And then we've also put out flyers, et cetera, that are always available in multiple languages to be able to share. But we really do rely a lot on our city partners and our community-based organizations that can help get information out to people. And as a part of our COVID response, we've contracted with 12 organizations that serve that work sort of countywide. And that does include 211 and La Familia. I think My Eden Voice, Eden Church is another part of that as well. And so those organizations meet weekly to share information and to get the latest information from us. And the idea is that they can, we want to provide facts that they can then turn around and offer in a culturally responsive way to their communities.
Yeah, I'll speak to Eden Church. They've been great partners with us, reaching out to particularly the Hispanic community, to the undocumented. They're in Cherryland and serve quite a few people in Hayward, as well as Ashland and San Leandro. So that's one I've got personal experience with, and I like them a lot. Educators. So people who work in schools, whether they're the people who are keeping the school clean, painting the school, or teachers, they're becoming a special class as of March 1. 10% of vaccines are supposed to go to them. I don't know how long that'll take to get through all those folks in Alameda County, but if you are working in the schools, either currently or you will be once they reopen, what's the best way to show you're eligible and get the vaccine?
Yeah, so in Alameda County, at all of our pods right now, people in the education sector, including everyone you just mentioned there, Dr. Quirk, are eligible. But again, because so much of our population in that phase 1B is people over 65, the appointments for the other groups, we just have smaller numbers of appointments. So it'll take a while to get through. But I would recommend that if you work for a school district, to reach out to your school district, because they've probably already coordinated with the Alameda County Office of Education, which worked with all of the school districts to put together a prioritization framework. So putting at the front people who are working in-person programs right now, and then moving all the way down to people who are able to work from home. And then they worked with the Coliseum, and they had a mobile pod already. But if that's not working, then also sign up for the county notification list, because we'll also be doing educator appointments at the fairgrounds, as well as our other pods. And as a last resort, try My Turn.
Okay, so for the Coliseum, how do you sign up there specifically?
It's through My Turn.
Through myturn.ca.com, okay, which has no appointments. All right.
That's kind of the problem everywhere. We have very limited vaccine supply.
Frankly, I think the bigger problem in the long term is going to be not so much people who will never want to get vaccinated, but people will just have a hard time giving it the priority. And by, I bet, a month from now, appointments will just go without being taken, because people just, they're younger, maybe they don't feel they'll have a problem, whatever. I think that's going to be the biggest challenge in the long run. To get a large fraction vaccinated. It isn't going to be the anti-vaxxers. It isn't going to be that people can't get appointments. It'll be getting people to get to the appointments that are available. Hard to believe that now, because the people who really want it are out there, but that's going to change, and we're going to have a lot more work to do. Thank you very much, Anika, and thank you for all the good work the county's doing. I know they're working very hard to get out, particularly to affected groups that aren't part of the system and find it harder to navigate the system. So thank you very much. Scott, I was a postdoc once. I suspect Tim Brewer had his time as an intern, and we've all been through this when you had a doctorate degree. So first question will be, once you already have gotten COVID, and there's certainly a lot of people who did, when should you get vaccinated?
Well, the current recommendation from the CDC is that anyone who has got COVID-19 should still get vaccinated. And this is kind of an interesting situation, because for a lot of infectious diseases, and especially viruses, you'll find a situation where natural infection will be immunity that is sometimes stronger than a vaccine, because the vaccine is essentially trying to imitate the natural infection. But with COVID-19 and SARS-CoV-2 infection, it's actually the reverse. And this is essentially because SARS-CoV-2 is able to evade your immune response, and is even able to kind of like push the immune response in a way that is not as protective as the vaccine itself, because the vaccine is targeting a sensitive protein, and the virus itself could skew that. And there's some new literature on the topic as well, that people who have natural immunity to COVID-19 have less effective antibodies compared to people who have been vaccinated. And then the other kind of unknown here is how long your antibodies or your immunity will last from natural infection versus the vaccine. And at the end of the day, really not that much time has passed since this pandemic has started. For some infectious diseases, natural immunity can last years and years, and some it wanes, goes away over a year. So the question right now of how long your natural immunity will last is not known, and whether that immunity is as strong as the vaccine is probably it's not as strong. So you're still more protected if you go and get the vaccine.
I've heard that the CDC is recommending about 3 months, only asking for that delay so people who have no immunity can get it first. But they're suggesting that your immunity is probably down quite a bit after 3 months, and you should look for a vaccine about that time.
Yeah, that's right. So, I mean, and that's also kind of like as far as people have looked in different patients, you can monitor antibody titers waning in these patients over time. And I think that's what's been observed. So if the idea is that these people who made the right immune response have it for about 3 months, they would say that, okay, you're probably protected. But then, yeah, after that, it wanes.
Okay. Then is there any data yet on the effect of vaccines on pregnant women? Now, there must have been some women in the original study who became pregnant, but still it's probably small numbers. What information do we have? And if your wife were pregnant, would you be asking her to get a vaccine or not?
Yeah, so what we do know is that certainly pregnant women are more at risk of getting severe disease and becoming hospitalized upon being infected with COVID-19. While you're right, the numbers of pregnant women in the Pfizer trials is small. Actually, in the Pfizer trial, 23 patients became pregnant during the process, and as far as physicians know, there was no adverse effect in this population. And they are actually doing additional phase 2 and 3 clinical trials on populations of just pregnant women. So as far as we know, it's safe. The numbers are still small. And the direct question that, yes, if my wife was pregnant, I would still insist that she get a vaccine.
Good. I've been vaccinated. I'm 75 years old. Should I be worried that if I go and see my children who are 33 and 39, that I might be able to spread the vaccine to them? Excuse me, I wish I could spread the vaccine. Spread the COVID to them. Could I have COVID and not have any symptoms and spread it to them?
Yeah, so the short answer is we don't know the answer to this question yet. And simply that's because not enough time has gone by. The way these vaccines are designed, because they target the spike protein and because essentially if you have antibodies against the spike protein, you should prevent the virus from invading your cells. And because we do know that the amount of virus that you have, that you're shedding directly correlates with how infectious you are, we would predict that vaccinated individuals who are protected would be far less likely to transmit an infection than individuals who aren't vaccinated. But I guess with that, there hasn't been enough time to really watch this play out and see if vaccinated individuals can spread. But yes, we would predict that it would be safer.
Safer, but we just don't know. There's a lot we don't know because it hasn't been around.
Yeah, it's a moving target.
So right now, I think it varies from one vaccine to another, but we also haven't tested this out in individuals under a certain age, 16 or 18, somewhere in there. When do you think we'll be able to vaccinate younger people and say in various age groups?
Oh man, so again, I think that would be a little bit out of my wheelhouse. I think that would have to do with how well the efforts are in vaccinating older, more sensitive populations, how effective those efforts go, and vaccine supplies. I mean, I think that that would be the priority, and then you would start focusing on younger populations.
Okay, well, it'd also have to be phase 3 trials in that age.
Yeah, I think so.
All right, Dr. Brewer. Do you have any comments on the questions I've just been asking Dr. Bierin about?
Sure. So let me jump in on two. Regarding pregnancy, so the two vaccines that are currently available, all they include is a little piece of genetic code that your body then translates into a protein. There's actually no live virus in that vaccine, so it cannot cause disease. So if you're a pregnant woman, do not worry, definitely get your vaccination. And then as Scott mentioned, we have very limited data on do these vaccines prevent infection as opposed to prevent disease. We know they're very, very good at preventing disease, not so sure whether or not they prevent infection. There are data, for example, on AstraZeneca vaccine to suggest that maybe it does prevent against infection, about 54%. Don't really have data on Pfizer and Moderna. And then finally, I was checking because I knew it was happening today. The FDA has actually approved the Johnson & Johnson vaccine. So that just happened. So hopefully the CDC Advisory Committee on Immunization Practices, which is the next step, will again approve that. And that will help to address the very challenging problem that Anika mentioned about vaccine supply. So having another vaccine on board and available will help us. And for those of you who are concerned about which vaccine you get, do not worry. No difference really at all between the Pfizer and Moderna. There are logistical differences in how we have to handle them, but in terms of side effects and protection, essentially no difference at all. And the Johnson & Johnson vaccine, 100% effective, preventing serious disease, hospitalization, and death. So any vaccine you can get, as soon as you can get it, please go ahead and get it.
Okay, and then for when do you think we may be able to vaccinate kids in high school and elementary school? When do you think we'll have the testing done so we'll know it's safe and effective in that age group?
So those studies, as Scott mentioned, are already underway. So Moderna and Pfizer both have trials now with kids 16 and older. I think that we're probably going to be vaccinating these groups by the summer, certainly by the fall. So I think the real issue is going to be supply more than studies, to be honest.
Okay, so we're hoping by the fall that we'll have plenty of vaccine. We're supposed to have plenty by the end of the summer. At what point do you think we'll be able to assume that, I don't want to use the term herd immunity, but basically that the virus, if it comes into a community, will not spread wildly, that R will be less than 1, meaning that less than 1 person will be infected, so that any infection will die out over time, only over time, because, it still can spread, but will spread less effectively. So assuming that, when do you think we'll get to that point? And does it matter whether we're still wearing masks and keeping distance, et cetera? How would you see us sort of getting back to, maybe we'll never get back to pre-COVID, but how would you see us sort of arriving there?
So a lot of questions tied up in that. Let's start with the last one first. Then, will we get back to pre-COVID? And the answer is no. Think of it like 9/11, right? So we're 2 decades plus past 9/11, and we still take our shoes off when we go through security in the airport, right? So there are some things that we're never going to go back to. You will see people in the bank with a mask on and no one will pull a gun on you, right? Whereas 2 years ago, that wouldn't have happened. So we will see more mask wearing, I think, going forward. We'll see other changes like that. I don't think the plexiglass in the supermarkets is going away either around the cashiers. However, in terms of herd immunity, we may actually be starting to get there, right? So if you look at the modeling studies, we need to be somewhere probably between 60-70% of the population. Well, we know that 30 million Americans have tested positive for COVID-19. We also know that somewhere between 40 and 60% of COVID-19 infections are asymptomatic. So the number of people that actually have been infected is probably a minimum of 3 to 4 times that. So you're talking now about 120, 150 million people potentially have already been infected. We're vaccinating people at a clip of about 1.7 million vaccines a day in the United States, if you look at the country as a whole, and we're trying to push that up. So if you look at where we are today compared to where we were at the end of December and beginning of January, both in the state of California and the country as a whole, our case rates are about 1/3 of what they were then. I don't think that's because we've gotten so much better at wearing our masks and physical distancing, right? So we've seen dramatic declines in case rates, and that's probably because we are starting to hit in certain populations and regions that herd immunity spot. You know, particularly places particularly hard hit like Los Angeles County, New York City. So I think we're starting to get there, but please do not take this to mean stop wearing your mask, okay? So please wear your mask, keep your physical distancing, wash your hands, because as someone who is taking care of COVID patients in the hospital, including patients in the ICU on ventilators, this can be a very serious disease, and we need to protect everybody from this virus.
We're hearing about variants. There's one here in California, which I gather has, particularly in Los Angeles, become very prevalent, perhaps because it's out competing others. So there's really, Scott has already said, and I think, or perhaps it was you, but I think there's general agreement that the vaccine should be effective against the variants, at least the ones we know about now. Some people are worried because of the South African data, but there's a lot going in South Africa besides the fact that they had that variant. For one thing, they had huge incidents of HIV. So I wouldn't take from that there's a problem with the vaccine and the South African variants. But you know, how long do you think will be, so for flu, every year there's a new variant. Mm-hmm. Our immunity doesn't last very long. Do you think we're going to be in that same sort of shape? Maybe we'll get one shot for a booster shot for COVID and flu all in one?
So great question, and Scott could answer part of this much better than I. So just a slight modification of what you said. I think there is good data from the laboratories now to show that the South Africa and Brazil variants, which have the same genetic change to them, are less well inactivated by antibodies, either from previous infection or from vaccine. But the question is that level still high enough to give you protection? And we think yes. So the levels are much lower, but they may still be high enough that you're still protected. Scott, would you agree that's your sense of the literature too? Okay.
Absolutely.
Yeah. So that's the good news so far. And the California variant does have a unique change to it that's somewhat different from the other ones. So we'll have to see how that plays out. There's a study from Cedars-Sinai here in Southern California, where in Los Angeles County, basically that particular strain went from not existent back in July to now probably a majority of the number of virus that they're identifying as of January. So it probably may be able to outcompete some of the other viruses. How that affects the vaccines, don't know yet, but very, very interesting question. So at least right now, the vaccines seem to be doing their job, particularly against serious disease, hospitalization, and death. There are data from South Africa to suggest at least the AstraZeneca vaccine was not effective in preventing mild and moderate disease, but that's okay as long as we keep people out of the hospital, keep them from seriously getting ill, and keep them from dying. So I think that's all good news.
Great. So right now,
I guess I can add to that one of the initiatives of a lot of the research labs and universities across California right now, especially ones that have biosafety level 3 laboratories, which is the containment that you need to work on dangerous viruses like SARS coronavirus 2. a lot of our focus has shifted away from therapeutics at the moment to monitoring what we're called variants of concern. So we are putting a lot of effort into directly comparing these new variants as they emerge to figure out, can sera from vaccinated patients neutralize and destroy these viruses as they arise, right? So not just the ones that are kind of like found in isolation, but ones that are found in hospitals every day. So in theory, we would know before there was one that was going to kind of run rampant through the population.
And then, of course, with this new messenger RNA technique that Moderna and Pfizer use, they say that in a few days they could turn their manufacturing around to new variant.
So that's, and if, yeah, keep going.
Yeah, all I was going to say is that's actually true of all the major vaccines available. So the difference between the Pfizer, Moderna, Johnson & Johnson, and AstraZeneca vaccines and what we traditionally use for influenza is that these are plug-and-play vaccine platforms. What that means is the vaccine platform was designed that you can swap out one antigen and swap in a new one very quickly to change the vaccine. In fact, the Moderna vaccine was built off their platform for HIV and Ebola, right? The AstraZeneca vaccine, same thing, was an Ebola vaccine where they swap out the Ebola antigen and they swap in the SARS-CoV-2 antigen. So that's going to give us the ability to respond much more quickly to make new vaccines as we need to address the variant. And to your question, Dr. Quirk, as to whether or not we'll have to get a COVID vaccine every year like we do influenza, we're going to have to just wait and see. But the technology exists to do that, and the regulatory capacity exists to do that. So if that's what needs to be done, we can do it.
So my wife and I yesterday both got our second vaccine shots of Moderna. Is it going to be safe for us to go through an airport and travel 5 hours on an airplane to Hawaii come the end of March?
So people are already doing that, whether it's safe or not. They are traveling. If Boeing is to be believed, and Boeing has sponsored a series of studies, they estimate the risk of infection in about 1 in 2.7 million travelers on airplanes. Airplanes are actually designed to prevent infection transmission. I won't take you through the airflow of how airplanes work, but they're actually very well designed to prevent the transmission of respiratory viruses. And your bigger risk is probably in the airport and all the other places where you're out in public, rather than just necessarily the airplane itself. That having been said, if you are going to travel, make sure you're wearing your mask, you keep your physical distancing, you wash your hands, and you don't travel if you're symptomatic, right? So if you or your wife have a cold, you're sick, you stay home till you're better, okay? And if you do that, then you're probably okay.
All right. So then the worry you'd have with two recently, month ago, fully vaccinated people is more the possibility of spreading than of getting the virus.
Exactly. The vaccines seem to work very well against preventing disease, particularly serious disease. So as Scott mentioned, we don't have good data for particularly the Pfizer and Moderna vaccines on whether or not they prevent infection. To give an example that you and I will both recognize, but some of our younger audience may not, the Salk vaccine for polio was terrific at preventing disease. It did not, however, prevent infection and therefore did not prevent transmission of polio virus. It actually took the Sabin vaccine, the oral vaccine, to be able to prevent transmission, right, and prevent infection. And so we just don't know where we are yet with the Pfizer and Moderna vaccines. Is it behaving more like the Salk vaccine and preventing disease, or will it also behave like the Sabin vaccine and prevent infection as well? But people like Scott and others are working to get that very valuable data for us.
Well, that's excellent. Then for those who who are vaccinated and are not vaccinated. There's been some discussion of double masking. If any of you, Scott or Timothy, could answer questions on double masking.
Sure. So the real key thing about masking is having a good fit. So the double masking came out because the U.S. Centers for Disease Control and Prevention recently, within the past 2 weeks, published a study where they took two like fake people and they made one cough and one had receptors to see if it got exposed to the aerosols that were being generated by the cough. And the short answer is, if you wear what we call a surgical mask, or it's called a medical procedure mask, it's a technical name, but you know what you see on TV, the surgeon's always wearing. If you're wearing your mask and the other person is wearing their mask, you reduce the risk of exposure by about 84%, according to that CDC study. Now, if you do a double mask where you put the surgical mask on first and then a cloth mask over that surgical mask, you reduce that exposure risk by about 96%. So it goes from 84% to 96%. So you do get a benefit, but it's not so much better than just the mask alone. If you just take that same surgical mask and you either put something over it to make it fit tighter, or you tie the strings so that it's tighter on your face, you get about that same 96% effectiveness in preventing exposure, right? So the key to it is not the number of masks, it's really how well do the masks fit on your face. And what the double mask is really doing is just making sure that you have a better fit. So the most important thing, the take-home message for everybody listening is just make sure you have a good fitting mask and that you use it.
I use tape actually to keep it from leaking around the nose area. Seems to be a problem for all of us. Those Korean, KF94s are, I think, better at that.
Right. So an N95 respirator, which is a type of mask that I wear in the hospital when I'm taking care of patients with tuberculosis, for example, does provide a better fit. And I actually have to be fit tested to make sure that it's working properly when I use it. That does provide a better fit than the cloth masks or the typical surgical mask that most people use. But anything to sort of get a better fit on your mask will help. I don't know, Anika, if from the public health department you have anything you want to add to that.
Yes, go ahead, Anika.
Excuse me. Yeah, no, I think what we hear from our health officer is the same, that wearing a mask is good, and you've got to just sort of at some point make sure you can still breathe. But more layers are always going to be better. But ensuring that good fit is really, really important. And so our push is for people to wear face coverings regardless of how many they wear.
Okay, well, we have 4 minutes left. Do any of our guest speakers have any last comment they'd like to make to our audience of about 80 folks?
I think just from the Healthcare Services Agency, I really, really want to just appreciate everybody. We know everyone is sick of the pandemic, and we're all excited for vaccine, but really appreciate folks being helpful in not jumping the line when it comes to getting vaccine, and also please continue to follow those precautions that you've taken throughout the pandemic. So keep your distance, wear your mask, avoid crowds. We're on the positive side of this, and I think this year is going to hopefully get us out of it. So which is a call for keeping up with the prevention.
Okay, so one of my takeaways is we're really going to be interested to know whether or not the Moderna, Pfizer, and other vaccines really prevent us from spreading the virus. That would be very great news to hear and could possibly get us back to close to normal. I think I'm going to be wearing a mask in public for a long time. I have not gotten a cold or flu in this last year. And for that, I'm very grateful. So thank you, everyone who is here to listen. And thank you, our 3 speakers. I've learned a fair amount today, and I'm sure that others who are listening are learning a lot too. And again, if you're not sure how to get your vaccine, if you just do a search on Alameda County Public Health vaccine, you'll find your way to a place to get a lot of good information. So thank you, everyone. And I'll be officially closing this now. And again, thank you all so much.
Goodbye.
Thank you, Dr. Quirk. Bye-bye.